Good morning, everyone, to the Cook County Health and Hospital System Special Finance Committee meeting, which is reconvening from this past Monday to have public hearings on the Cook County Health upcoming year fiscal year budget, which will be after when passed, when a budget is passed, whatever that is, we'll then go to the Cook County Board of Commissioners to be wrapped up into their budget. We are going to conduct the meeting like we did the last meeting, and that is first, we would revisit the roll call from the previous meeting. I don't know that we have to, do we?
We could just announce who's present.
Yeah, announce who's present,
Sure.
because it's the original roll call from the convening that matters.
So we have Director Masuda Barnett and Chair Ryder.
All right. I think I did this last time, just for a note of parliamentary procedure. You take roll at the beginning of the meeting, not after the recess,
That's right.
unless someone calls quorum.
Exactly.
That's right. But we don't need quorum because
There's no action.
we're not taking a vote, and this is for the public. Now that I've fully explained all that, as I'm thinking through it out loud, we are going to first go to the budget presentation, which is going to be presented by our interim chief CEO, Scott Spencer,
CFO.
CFO, CEO. I did that last time too, didn't I? So thank God Eric's not here, although Eric's listening online. Sorry, Eric.
I'm here. It's okay.
Yeah. We are, again, for any of our directors who are online that were not at our last meeting, we are going to hold all questions from directors on the budget until after the budget presentation has been presented by Scott. That way, we're not asking questions that will be answered on an upcoming slide, so everyone has the full context of the presentation. Eric, you were not able to attend the last meeting, and I know that you're dealing, like many people in the region, with flooding issues and whatnot, as we're now through another round of storms in our area, which in and of itself also becomes part of our reps, rolls up into all the public health issues that we fight and contend with every day. Do you have anything before we go to Scott?
No, I think I would just reiterate, my word of thanks that I started with when we opened this ongoing meeting. The team's done a lot of work again. Since the election in 24, we've trimmed $315 million in expense from the budget, and again, have done a lot of work to get where we are right now. As has been mentioned, we have that $40 million left that we are asking support from the county to close, so we don't have to think about service reductions for the communities that we serve. So appreciate everybody's hard work on this. Appreciate the support of the board, as well as our commissioners, and of course President Preckwinkle.
Yeah, I'm going to hold my comments until I'm going to make, I have similar comments that I made at Monday's meeting, because we have a new group joining us today. But I'm going to hold until the slides that I'm interested in highlighting are presented. So Scott, go ahead. The floor is yours.
Okay, thank you. Good morning, everyone. Scott Spencer, interim CFO for CCH. So walk you through the presentation. We'll start with accomplishments from 26 and key initiatives for fiscal 27, and then we'll get into trends, budget drivers, and then the budget itself. So our 2026 accomplishments, a lot has occurred. This is a very full slide, just going to highlight a few, including the health system being awarded Provider of the Year by Wellness West, the Department of Public Health launching Healthy Beginnings, which is a program to support new parents and babies and reduce disparities. The health system being awarded $5 million award along with City Colleges of Chicago by the Pritzker-Traubert Foundation to create a workforce development pipeline out of Providence Hospital. We've expanded access to care by growing surgery volume in Providence by 45%. Achieved 75% of our value-based care metrics, which is up from 20% last year. We were successful in renegotiating our Medicaid encounter rate. We continue to support Medicaid enrollees through a variety of redetermination events and launching the CCH Medicaid Impact Work Group, which includes the Medicaid Get the Facts public education and outreach program. We've earned a new Health Choice Illinois contract from the state, and also wanted to highlight County Care's market share, which is at the high water mark of over 35%. Moving on to 2027, again, a lot to be proud of, and we want that momentum to continue into 2027. Again, highlighting a few items here, including optimizing services at Providence to increase capacity and a number of patients we serve, maximizing clinical productivity, utilization, and focusing on keeping patients within our system. Entering into more value-based care agreements and achieving improved quality outcomes and performance revenue. Making further progress on our hiring processes, including additional insourcing and reducing agency cost. Continuing to demonstrate to County Care members the value of receiving care at CCH. Continuing to do all we can to ensure County Care members and all Medicaid enrollees in Cook County retain the Medicaid coverage for which they are eligible. And then lastly, working to improve the revenue cycle through denial reduction and improved billing technology. So the trends and budget drivers, I want to take a moment and reflect on the federal landscape. We have seen a variety of federal funding cuts and anticipate that'll continue to have significant financial pressure on the health system. In 2026, we have experienced reduced ACA marketplace subsidies. Patients have been impacted by reduced ACA marketplace subsidies and have seen, in general, Medicaid eligibility changes that have increased the number of uninsured patients. And then looking to 2027, preparing for the new Medicaid work requirements and the change in the redetermination cycle, which will go from every 12 months to a 6-month cycle. So as coverage declines, more patients will rely on Cook County Health as their safety net provider, and at the same time, other safety net organizations are expected to scale back services. So again, increasing demand for our system. The result is a challenging financial dynamic, higher demand, more uncompensated care, and lower reimbursement. We're projecting approximately $138 million less in patient revenue, which equates to approximately $100 million in additional charity care costs. The next slide, taking a look at our payer mix and charity care costs. We are anticipating in 2027 Medicaid to decrease to approximately 43% and the uncompensated to increase to approximately 30%. One of the good things to highlight that's occurred over the years is the improvement in Medicare, as well as the improvement in commercial. So compared to pre-ACA levels, our commercial has tripled to around 9%. So pre-ACA, it was about 3%. And then Medicare at 17.5%, which was approximately 8 to 9% pre-ACA. So as we look on the right-hand side and our anticipated charity care in fiscal 26 of $385 million, and in fiscal 27 projecting $485 million. So that's projected to increase approximately $310 million in 2025 and to $485 in 2027. Just to restate that, to make that a little bit more clear, the increase from 2025 of 310 to approximately 485 in 2027. So the next slide here shows CCH's commitment to hiring. A bright spot to share is our progress in growing our unionized workforce. And as you can see, the FTEs from 2024 has grown from 7,326 to the projected total for 26 and budgeted for 2027 at 7,761. And then you can see the agency spend and the progress that has been made there, decreasing from 190 million in fiscal 24 to a budgeted 70 million in 2027. So our key revenue and expense drivers, starting with revenue, we have volumes largely budgeted flat. We have a 6% increase anticipated on a per member per month basis for the County Care Health Plan. We also are reflecting revenue cycle improvements as well as various other rate increases, such as the Medicaid encounter rate improvement that I already mentioned, as well as improvement on the Medicare inpatient rate and some improvement on our wage index as well. We anticipate growth in domestic claims, which is county care members receiving care at CCH. And then we also have a proposed increase in the county tax allocation. The unfavorable drivers, as already mentioned, would be the reduced reimbursement as the number of uninsured and patients increase due to the changes anticipated in the payer mix. And we're also anticipating our directed payments will be decreasing as well. The expense drivers, we have a 10% expense reduction that is a carryover from fiscal 26, as well as a 5% reduction for fiscal 27. We have planned for reductions in agency, as well as reductions in professional and purchase services and medical supplies. And then we've included the salary and benefits increases due to the cost of living adjustment and step increases, as well as increased pharmaceutical expense driven mostly by inflation and utilization. And then, of course, the increase in the number of uninsured patients seeking care at CCH will also be a driver. So this slide highlights the expense elimination efforts. It became clear in 2024 that major changes would be on the horizon for federal healthcare programs. This slide shows where we were able to reduce costs, including position freezes, agency spend, contracts, purchase services, as well as leases and maintenance, and approximately 217 million in expenses were eliminated going into the fiscal 26 budget. Going into fiscal 27, the expense elimination efforts continue, still focused on curbing costs through position freezes and reducing agency. As you can see on the slide, we also have the cost of living increase and step increases included. The green bar in the middle, the reduction of claim expense of 422 million, not necessarily something to celebrate, as it does reflect the decrease in the health plan. So fewer members means less revenue, and commensurately fewer or lower claim expense as well. So we move into the budget here, focusing on the far right-hand column, showing net patient revenues decreasing by approximately 11 million, which reflects both the change in the payer mix that we're anticipating, but also the revenue cycle improvements that we're expecting. Directed payments decreasing by 72 million, and then the health plan services revenue of decreasing by 405 million. But as I mentioned, that is related to the reduction in the claims expense, which you see in the bottom, decreasing by 422 million. We also have, as I mentioned, a decrease budgeted for purchase services, contract labor, maintenance, and repairs. Do want to call out that, as mentioned, the 2027 budget is predicated on a $40 million increase to the Cook County tax allocation. This would increase the county allocation from 168 million in 2026 to 208 million. We've been working very closely with President Preckwinkle and the County Department of Budget and Management Services, and certainly are very grateful for their partnership and support on this increase. Wanted to share the historical depiction of what the county allocation has looked like to CCH. The allocation has long supported our unfunded but mission critical mandates, including the Cook County Department of Public Health, the provision of correctional health care and charity care. And just a couple things to highlight here is in 2013, the tax allocation was 250 million and represented nearly 30% of the budget. And in 2027, the proposed tax allocation is 208 million and represents approximately 12% of the budget. So we have been tasked with, as mentioned, closing a $40 million budget gap. This slide highlights what we would have to do, or what we could do to get there. It's not something we recommend or something we want to do, but what we would have to do if we don't get additional county funding. We are, however, as mentioned, cautiously optimistic that this can be avoided through an increase in the county allocation. So now we'll walk through the department, starting with Stroger. So just a few things to highlight as we go. As mentioned, the 10% reduction in FY26 carries over to FY27, along with a 5% expense reduction plan. And we'll continue to focus on reducing agency utilization, as well as we've included cost savings initiatives, so insourcing oncology nurses and advanced practice providers, as well as some insourcing within plant operation and facilities management. For Provident, the same savings reductions plan is included, as well as continuing to focus on expanding and maximizing capacity of outpatient services at Provident, as well as continued focus on reducing agency use. On the outpatient side, which is ACHN and CORE, again, the same expense reduction plan, but also continuing the ongoing efforts to increase patient visit volumes, maximizing schedules, and optimizing available clinic capacity, as well as focusing on reducing agency. Correctional health, which includes CIRMAC and JTDC, again, the same expense reduction plan and just continued efforts there to use resources efficiently. Public health, continued funding of ARPA and grant positions, as well as community immunization programs, and continue to focus on programs targeted at chronic disease prevention, as well as the Healthy Beginnings programs. Looking at health administration, efforts will continue to optimize the revenue cycle and maximizing denial reductions, as well as improving our billing technology. We'll continue to stay focused on and do any additional belt tightening we can in terms of non-essentials, including travel, conferences, food. Also focusing on continued reduction to agency use. The health plan services, so County Care Health Plan, a couple things to highlight, including just the 6% per member per month capitation increase that is anticipated, as well as highlighting the projected membership decrease coming in at just below 329,000. And the next couple slides just highlight the projected membership for each population and the contribution by each membership group. And then the membership slide, just highlighting the decrease in the membership that's occurred. Again, just to emphasize that while Medicaid enrollment in Cook County overall has declined by 23%, Cook County, County Care Health Plan has seen a decrease of 16%. So again, just to highlight the strong market share of the health plan. So just to wrap up, the key budget takeaways here would be the total budget of $4.7 billion, which reflects nearly $440 million less than the FY26 budget, and includes both the health plan and the healthcare services side. As mentioned, federal Medicaid changes are fundamentally reshaping the health system's financial outlook. Operational efficiencies that have been identified over the past few years alone cannot offset federal funding losses. And over the past few years, Cook County Health has eliminated more than $300 million in expenses through operational improvements and strengthening performance. The county support is essential to preserving access to care. As mentioned earlier, the budget includes a $40 million increase in county funding to help avoid patient care reductions and layoffs. We anticipate that demand for uncompensated care will continue to grow. But the mission of the health system remains what it has always been, which is providing high quality, accessible care and services for all residents, while navigating what will certainly be a very challenging environment in terms of federal funding. And with that, Chair Ryder, I will pass it back to you.
No, okay. So for those who appear, we've had directors ask questions from our first presentation of the budget at the original special meeting. I do want to go to this slide, and then one other slide really quick. Is this slide's very illustrative of the decrease, the sharp decrease in the county subsidy that then stayed relatively flat for a few years prior to the onset of the pandemic. Then we saw an increase in the county subsidy. The first one was the budget of 2020. I may or may not have been involved in pulling the, pushing to increase the county subsidy that year. We did push really hard for that. And then we've seen continued reinvestment into the health system by the county. And the county subsidy has to go up just by virtue of, inflationary drivers that happen, regardless of dollar amount can't stay flat. You have to have a budget that increases with the cost of being able to provide medical care for not just labor costs, but also industry costs, which is great. We did have a few years that were flat. That was during the time where we had an influx of ARPA money coming into the system. The ARPA money was used for a variety of things. One of the things that we've been able to do with the ARPA money is invest in new lines of care and better resources that we can deploy into the community. I feel very strongly about how we continue to do that based on everything else that we're facing in the broader system. We can go to the next slide, Debbie. As we look at this slide, you see categories that are called out as places where cuts can be made to achieve that $40 million. So the $40 million is an additional funding request to keep up with the growth and mitigate any other cuts we have. And this is with us holding the budget flat. Why are we holding the budget? Why are we in the position we're in? A variety of reasons. The biggest reason being the shift in healthcare that's happening prior to and also in conjunction with the federal government, specifically the Trump administration's attempt to destroy the Medicaid and Affordable Care Act systems. We are projecting a lot of constraint, and it's putting not only pressure on us, but on the other safety net institutions in our region. We're the largest, dare I say it, the largest safety net system in the Midwest, certainly in the state, and one of the top public healthcare institutions in the country. And we serve an incredible population, and we've been able to work with that population, and our care is like no other. And we've done a lot, especially the last few years, to work on staffing, cut down on outsourcing, and while improving our scores and delivering that service. Always do better, but we are in a better trajectory. We are in the best trajectory I've seen us on since I came to this board. I'm sure that if we had to fill that $40 million, that we would argue whether these are the three lines that would get cut, and then people would put them into other categories. But I am going to tell you that I plan not, my job here is, as chairman of the finance committee, to chair these meetings, and as a member of the finance committee and as a member of the board, to support the thing that I believe is the best for our community. And I'm on this board representing workers, not just the workers who work here, which are very important to me, but also the workers that depend on this institution as a going concern. Because as we see more constraints on area safety net hospitals, we know that shift is not going to go to the research hospitals and the institutions that see providing community benefit in terms of fancy looking clinics and tents and things like that. Like community health from hospitals isn't just handing out brochures and getting people to put names on buildings. It's the work that we do at Stroger, Provident, and our clinics, right? That we are the institution that bridges all those other institutions. We're the nexus. Not to say that our community outreach is the best community outreach, because it's backed up by service that's accessible to regular people. In my role my broader role, which includes being on this board, being a member of the Cook County community, being a union organizer, a working class person whose mother worked in the emergency room as a rank and file nurse, a charge nurse, and never lost that spirit. I will be going to help push the revenue at the county to get that $40 million, so we're not coming back here. There's going to be, because we're going to pass this budget, we're going to ask the county for $40 million, and the county is going to need to come up with $40 million. So I believe in this investment that the county needs to make, and I'm going to work downtown to make sure that we get a $40 million investment in this hospital that doesn't cut into all the other services that the county provides that are so important to working class people here in our region, and that we invest in the people whose time invests in us. So I welcome anyone who wants to join me on that journey, because at some point we're going to pass a budget, whether it's this exact budget, whether there's adjustments, and whether we have to come back. I'm chasing that revenue, so that way we can protect what we do here, and that we're not going to be on a perpetual path of being flat from here on out, because there's people in Congress and in the White House right now that could give two shits about the people who put their boots on for a living. So that's my comment. I believe we have Director Harrington also joined us. Do we have any other directors who've joined us since we began? Joe, do you have any questions or comments?
No, I don't have any questions or comments, but I will make the observation.
What did he? Well,
Director Harrington,
Can you hear me?
yeah.
we can hear you now.
Okay, yeah, I heard an echo. I can hear myself in the room as well. Yeah, I just want to make the observation that consistent with our mission, we're going to make sure that we continue to do our work and serve people to the best of our ability with the resources we have. And I'm confident we'll do that. I'm confident in leadership. And more importantly, I'm confident in our people.
All right, great. Okay, hearing no other comments from the director, Scott having wrapped up his presentation, we're going to now move to public comment. Debbie, so when we go into public comment, each speaker has 3 minutes. Secretary will remind the speaker when there is 1 minute left, and again, when their time has expired. This is to allow everyone to have the appropriate amount of time to speak. Debbie, do we have any virtual testimony for today?
We do have one speaker to remotely present testimony, but I do not see them connected. They were connected. Oh, Wesley, are you there? Okay,
Hi there.
Wesley is there. Yes, we do.
Why don't we knock that one out first?
Okay, Wesley, you can go ahead and provide your testimony.
All right, thank you. Good morning, everyone. I'm Wesley Upland. I serve as Policy Director at Health and Medicine Policy Research Group. I'm testifying regarding Cook County's FY 2027 preliminary budget forecast. Due to Medicaid cuts, Cook County Health, which anchors our local safety net, will have more uninsured patients and provide more uncompensated care. Medicaid cuts will destabilize Cook County Health and the broader safety net. If Cook County Health falters, many more people will go without needed health care. Many Medicaid members face overbearing, time-wasting paperwork, so-called work requirements designed to rob them of health insurance. The Republicans in Congress and the Trump regime are guilty of handing out tax cuts to the rich while millions continue to suffer poverty and worse health. In response, we have 4 main recommendations for your board for which we hope you will work directly with President Preckwinkle's and Cook County Commissioner's offices to press the budget case to better fund public health. We would like to see a $50 million increase. That's an increase over the $40 million already forecasted for Cook County Health, with a focus on covering uncompensated care and ensuring no cuts to clinical staff and bolstering community outreach and enrollment support. With service cuts likely across the safety net, Cook County Health needs more funding to build up services and ensure people who can't pay aren't being asked to, and reduce the wait times for care. We should all be concerned about staff reductions at Stroger of 54 positions and 30 at Provident. The Stroger losses are noted to be due to insourcing in county care, but that should not cost us clinical positions. We want county officials, this is the second recommendation, we want county officials to start a 5-year ramp up of funding for the Cook County Department of Public Health to double its forecasted budget of nearly $30 million in local dollars today to reach $60 million in corporate fund dollars 5 years from now. To start, we want a $6 million increase in this budget. This department has been underfunded and understaffed for decades, and increased funding is needed for such roles as sanitarians, community health workers, and communicable disease case investigators. This is especially true amidst decimation of our public health system at the national level, infectious disease outbreaks, and federal grant cuts to local health departments. We want creative, progressive revenue solutions and more priority to be given to health in this budget. A social media tax similar to the cities and a public health excise tax on warehouse truck traffic are 2 revenue ideas. Doubtless there are others. Regarding budget priorities, the police department's budget is forecast to receive a $66 million increase in funding in this budget, a roughly 80% budget increase. We need these dollars to fund programs for health and social uplift, not the carceral system, which already has a bloated budget. We suggest this board organize public hearings across the county and in partnership with local community-based organizations to learn how communities are hurting under the current federal regime, monitor their needs, and strengthen ties between hospital leadership and communities. Again, we ask you to make a formal request to President Preckwinkle and county commissioners to better fund public health and work through these recommendations. Thank you.
Thank you for your testimony. Do we have any written testimony that was presented? Before I forget about that.
We have written testimony from Esther Morales, and in addition, 2 of the speakers today giving oral testimony also presented written testimony that will be included.
All written testimony will be appended to the minutes of this meeting and included in the public record.
And posted to the website.
And posted to the website. Okay, now we're going to go to our registered speakers that are here present. So you want to go to the first one?
Yes. Amber Kirchhoff.
Hello and good morning. Thank you for the opportunity to provide testimony today in support of Cook County Health and Hospital Systems budget request. My name is Amber Kirchhoff. I'm the Senior Vice President for Public Policy and Advocacy at Thresholds. We want to express our gratitude to Cook County Health for their longstanding leadership and partnership in advancing access to care for residents of Cook County, including individuals living with serious mental illness and substance use conditions. Thresholds is one of Illinois' largest and longest serving community mental health providers, as well as supported housing providers, caring for over 14,000 individuals annually. Our service area extends across the greater Chicagoland region, with the majority of our sites and clients being located in Cook County. Our mission is to empower people living with serious mental illness and substance use conditions by equipping them with home, health, and hope. We advance this mission through mental health treatment, substance use services, care coordination, intensive outreach, housing, and other supports that help people stabilize, recover, and thrive in the community, avoiding unnecessary hospitalization and institutionalization. For years, Thresholds has provided on-site staff support at Stroger Hospital through our Emergency Department Deflection Partnership. Through this collaboration, we assess individuals presenting with behavioral health needs to decide whether hospitalization is appropriate or if the person could be better served in a different setting. We're pleased to continue this impactful work, which will be increasingly important as HR 1 goes into effect and we see more folks showing up in the emergency room. More recently, we partnered on the Assertive Community Linkage Program, a targeted intervention designed to engage individuals experiencing frequent ED utilization for behavioral health conditions. Program data shows that 76% of these individuals we worked with had a reduction in future emergency department visits. We moved 71% of them experiencing homelessness into housing. We also improved engagement in primary care, outpatient mental health treatment, and social services for our participants.
One more minute.
Uh-oh. We are also actively engaged with Cook County Health and the Medicaid Impact Stakeholder Work Groups, which are being led by Kathy Chan and Lisa Garza-Wichman-Harris. Thresholds greatly appreciates Cook County's leadership in facilitating the planning and coordination amongst healthcare providers, payers, advocates, community organizations, and policy experts across the region. As you all know, HR 1 introduces some of the most significant changes that we've seen to the Medicaid system since the program was enacted. Federal reforms will create new administrative barriers, more frequent eligibility checks, community and work engagement requirements that are expected to cause between 270,000 and 500,000 Illinoisans to lose coverage, largely not because they are ineligible, but because they will not be able to keep up with complex paperwork and verification systems. For people served by Thresholds, these risks are especially serious. Many individuals we support live with disabling mental health and substance use conditions, housing instability, justice involvement, and chronic medical needs. Gaps in Medicaid coverage can quickly disrupt psychiatric care, medication access, management of chronic conditions, and care coordination. Those disruptions are likely to lead to avoidable hospitalizations, emergency room visits, and crisis system involvement. These are immediate, not downstream effects for the Cook County system of care. Cook County Health's request, therefore, is not simply a budget matter, but it is an essential investment in the stability of the safety net for the entire region. Adequate funding is essential for sustaining the infrastructure needed to respond to HR 1 implementation, support clear communication with Medicaid members, coordinate with community partners, and prevent unnecessary coverage loss among residents who remain eligible for care. Lastly, I'll share that many Thresholds clients. Many Thresholds clients do have coverage also through county care. We know how critical that is to making sure that they have access to medication, therapy, psychiatric support, and so forth. So we appreciate the good work that they're doing there too. So we respectfully encourage favorable consideration of this request. Thank you so much.
Thank you. Next speaker.
Next speaker is Sharon Brown.
Good morning, everyone, and thank you for this opportunity to come speak before you today. My name is Sharon Brown, and I serve as Director of Operations for the First Lady's Health Initiative. I am also the First Lady of St. Mark United Methodist Church in Chicago's Chatham community. Cook County Health has been a valued partner of the First Lady's Health Initiative for more than a decade. Year over year, Cook County Health has provided staff at our church-based health events, helping us bring important health information, screenings, and services directly into the communities that need it the most. In 2026, our partnership expanded to include a special focus on HIV awareness, education, and screening. Together, we have brought this work directly into the churches, including Cosmopolitan Community Church and New Bethlehem No. 4 and Grace Central Community Church. As a First Lady, myself, I understand why meeting people in churches is so effective. Our churches are trusted spaces. People come through our doors to worship, but they also come for support, information, and connection with community. When we bring health services into that trusted environment, we can reach people who might not otherwise seek them out. Upcoming on September 13th, next month, extra month from today, after Sunday services, First Ladies will open the doors at 16 churches across Chicago's South and West Sides for our Health Day. That means 16 trusted locations on one day, connecting individuals and families with health information, getting screenings, receiving resources from health providers right in the communities where they live, worship, and gather. That kind of reach is possible because of strong partnerships sustained through Cook County. So as you consider the budget, I ask you to continue investing in the community partnerships that bring health directly to the people who need it the most. For more than a decade, Cook County Health has shown up alongside us as we continue to build on that partnership, reaching more residents, removing barriers to care, and ensuring our communities have access to the health resources that they need. So on behalf of First Ladies, I just want to thank everyone for the budget and continue our partnership. And I'd like to say a special thank you to Marcelina, who actually makes sure that we have staff at each location to make sure that people get the information they need. Thank you again.
Thank you. Next speaker.
Next speaker is Rodolfo de Jesus.
Good morning, Board. My name is Rodolfo de Jesus, and I'm the Director of Government Affairs at the Greater Chicago Food Depository. We work closely with Cook County Health to alleviate hunger in the county. We know that nutrition is a crucial element of preventative care, and that the Food Depository, we believe a healthy community starts with food. According to recent census data, more than 1 in 4 people in Cook County are experiencing food insecurity, meaning they struggle to access the nutritious food they need to live healthy lives. Inadequate access to food has dire consequences for morbidity, mortality, and the overall health and well-being of children and families. It has been a challenging few years for many of our neighbors. Due to inflation, elevated food prices, and changes to SNAP, many families find it hard to put healthy, nutritious food on the table. Unfortunately, these challenges will worsen with the new work requirement changes from Medicaid going into effect in January, on top of the devastating changes to SNAP already implemented that have led to 100,000 people in Illinois losing their benefits. The Food Depository is proud to have partnered with Cook County Health over the past 12 years on several important programs. Together, we have incorporated food insecurity screenings at all Cook County Health outpatient health centers. Patients who screen positive for food insecurity receive valuable information and resources to access healthy food, including a list of locations where emergency food is available and a referral to our SNAP hotline to apply for nutrition benefits. Patients at Belmont Cragen and at Provident Hospital have access to an on-site pantry, and this past year alone, there were 2,372 patient visits to the on-site pantry at Provident Hospital. Of those patients, 71% saw improved blood pressure and 63% saw improved A1C levels as they worked to develop their health goals and gain more consistent access to healthy foods. In addition, we have partnered with the Lifestyle Center at Provident Hospital and the RISE Center to identify cohorts of Cook County Health patients who experience food insecurity while managing chronic health conditions. Through this collaboration, eligible patients receive weekly deliveries of nutritious, scratch-made frozen meals for 6 months, supporting their health and well-being. Our partnership also thrives through collaborative policy efforts, particularly through coalitions such as the Alliance for Health Equity and Protect Our Care Illinois. Together, we have advanced critical conversations about food as medicine framework, emphasizing nutrition's role in improving health outcomes and reducing disparities.
1 minute remaining.
Our joint advocacy has been instrumental in shaping the direction of Illinois' Medicaid 1115 waiver, ensuring that community voices and equity-focused strategies are central to the design and implementation of innovative health interventions. This shared commitment reflects the strength of our alliance and our dedication to driving meaningful systemic change. It has been wonderful to see our partnership grow into more patient-centered models that can sustainably address food insecurity. The Food Depository wishes to thank the Board of Directors for their leadership and commitment to ending hunger in Cook County. As you continue the fiscal year budget process, we urge you to continue investing in the important work that we have achieved together. Thank you all.
Thank you. Next registered speaker.
Next speaker is Blaise Hernandez.
My name is Jessica Macias, and I'll be translating for Mr. Hernandez.
Primero, quiero dar las gracias a Dios, a ustedes, por toda la ayuda que nos han dado, todo el servicio, gracias a todo el personal, doctores, enfermeras, por todo bonito y lindas personas para ayudarnos.
First, I would like to say thank you to the personnel, to you guys here, and to God for all of the good care and service that I have received here at this hospital.
Ya tengo, gracias a Dios, soy sobreviviente de cáncer por 2 veces. La última vez estuve aquí el año pasado y muy bien atendido. Muchas gracias.
So thank you to God. I am a survivor of cancer twice, and I was here last year and was very well attended by the staff here.
Y yo quiero desearles bendiciones a todos porque gracias a ustedes, a su profesionalismo y aparte que son unos seres humanos que atienden a la persona como combinado por su experiencia, pero su humildad de persona.
I just want to say thank you to your professionalism and for treating us like human beings. And I forgot the rest, but he said thank you.
Sí, pues muchas gracias y que Dios los bendiga a todos.
Thank you very much, and God bless you all.
Thank you. Next registered speaker.
Next speaker is Jen McGowan-Tomke.
Thank you, Chairman and members of the Cook County Health Finance Committee. Thank you for the opportunity to speak today. My name is Jen McGowan-Tomke, and I'm the Vice President of Policy and Health Equity at Trilogy, a community-based mental health and substance use treatment provider serving Cook County. Our mission is to help people in mental health recovery build meaningful, independent lives through comprehensive, integrated care. For more than 50 years, Trilogy has served individuals living with serious mental health conditions, substance use disorders, homelessness, and poverty, helping people facing multiple barriers move towards recovery. 2 years ago, the Cook County Health Office of Behavioral Health awarded Trilogy a $1 million Stronger Together grant. This investment enabled us to expand mental health services for children, adolescents, families through our Your Chicago Youth Mental Wellness Project. We knew the need was greatest in historically underserved communities and communities of color, and Cook County Health's support came at a critical time as demand for youth mental health care continued to rise. With this funding, Trilogy expanded preventative services on both the north and south sides, opening 2 locations to improve access to care. We added a youth-focused psychiatric provider, a registered nurse, and therapists, including a team dedicated to serving children and families on Chicago's South Side. As a result, hundreds of families and youth who previously lacked access to services now receive timely, compassionate, and integrated care. Trilogy has also been an active participant in the Medicaid Impact Working Group, and we are grateful to Cook County Health's leadership for responding to HR 1. Federal policy changes put many of our clients at risk of losing health coverage, and we know health systems across the region will feel the impact. We cannot afford to wait and see what happens. Instead, we must work together to keep as many people covered as possible. The Medicaid Impact Working Group is doing exactly that by coordinating education, outreach, coalition building, and provider collaboration.
1 minute remaining.
Trilogy has helped elevate challenges facing behavioral health providers, including limited access to Medicaid eligibility information and barriers clients face when using electronic systems such as Manage My Case. Through this collaboration, we have tested new processes and improved access to critical information through Cook County Health's provider portal. The working group has already produced meaningful improvements, and we look forward to continuing this partnership to protect coverage for Cook County residents. Thank you for the opportunity to highlight our partnership and for Cook County Health's continued investment in strengthening behavioral health services across our county.
Thank you.
Next speaker is Elizabeth Lawless.
Good morning.
Good morning. Good morning. My name is Elizabeth Wallish. Coming up. I'm a nurse in the medical surgical division at Surgeon Hospital, and I've been a nurse at Cook County Health for 15 years. I'm also a union representative with the National Nurses Organizing Committee. We understand that there's a $40 million financial hole that needs to be filled, and we hope that progressive revenue sources can be found. But we have some suggestions on how Cook County Health could cut unnecessary expenses. An obvious way is to stop wasting time on litigation and attorneys in attempts to stymie the nurses in enforcement of our contract. We have an arbitration scheduled every month of this year because management refuses to settle, even when there are blatant violations of the CBA, that's our collective bargaining agreement. Just 2 weeks ago, management failed to provide crucial information we requested, requiring an arbitrator's subpoena to get documents we always had the right to access. Arbitrators are expensive, and the union offered a settlement that would have saved the hospital 2 years of back pay, but the hospital refused and insisted on having a hearing where they will almost assuredly lose. This is not just deplorable because it's union busting, it's deplorable because it's a waste of taxpayer money that should go on to patient care and not the pockets of bureaucrats whose sole aim is to take away the rights of nurses at Cook County. Here are some more examples. We are now moving into another hearing date this month for a case heard in April concerning the forced mandatory overtime of cath lab nurses. We have mandatory overtime laws for nursing in this state, and management is regularly violating the statute and the contract, resulting in over 25 grievances. This is a moral issue with simple solutions, but it's almost as if the operations team at Cook County enjoys the exploitation. We have multiple attorneys, Rachel Morello, P. Scott Montgomery, along with a nurse director, head of security, and other miscellaneous HR staff attend a pointless investigation meeting where a nurse was accused of, quote unquote, theft of chocolate that was left at the nurse's station for everyone to share. It was found after a lengthy investigation that the chocolate was not stolen. Thank God. Nurse Mimi simply placed it in a drawer because it turns out you can't have food at the nurse's station. How does management have the time for this investigation but struggles to find the time to balance schedules and post them on a regular basis? They have time for this, but nurses struggle to get tuition reimbursements, often waiting months and months for a check from county. Yeah, we had to grieve the chocolate issue too, because Amy O'Malley seems to be concerned with confectionery crimes. So nurses are left wondering what days they are scheduled to work in violation of the CBA. It's not lost on us the racial implications of white managers falsely accusing Black nurses of theft, especially at Providence Hospital, a historically Black hospital. Time and resources should be invested directly into patient care, and as public servants, the CCH's attorneys should comply with this obligation or be cut from the budget. Thank you for your time and attention, and we look forward to your necessary oversight to investigate and consider these concerns.
Thank you, Elizabeth. Next speaker.
Next speaker is Tina Montañez.
Good morning, board. My name is Tina Montanez. I'm a nurse in surgery. The CCH system, the CCH system can and should better regulate agency overtime. Agency nurses are being given as much overtime as they like in the main OR. We again had to file grievances on this overtime issue again, a waste of time and money. We are also requesting that CCH stop pulling nurses from other units to cover staffing shortages. Using nurses from other departments as a temporary solution is only putting a Band-Aid on the underlying understaffing problem. We also want to address and ensure compliance with our bargained agreements, including agency onboarding, ending agency extensions, and posting PID positions on Taleo to help fill our significant RN vacancies. We also want to address the bargained expansion of the float pool to 25 RNs, 5 designated for each area: ICU, Med-Surg, ER, L&D, and surgery. These issues are directly impacting staffing and patient care, and I believe they need to be addressed at the board level. Lastly, we don't need an army of attorneys at every investigation or at every meeting with the union. Back in 2018, during other budget crisis, the hospital eliminated a lot of the attorney positions dealing with labor issues to save money. Instead, they had nurse managers trained to do investigations and settle grievances. And you know what? It worked. We want fewer arbitrations that are a result in better labor relations and issues solved at the first and second steps of the grievance procedure. It's rare for us to even get a second step hearing these days because management fails to provide availability, forcing us to advance dozens and dozens of grievances to BHR. We know that this is at the direction of Cook County Health attorneys. So if you want to save money, start at the top. Downsize management positions, downsize agency use, downsize CCH attorneys. Rachel Morello, Carrie Pramuk-Volk, Philip Scott Montgomery, who are wasting tax dollars on union busting. Thank you for your time and attention. We look forward to your board oversight to investigate and consider these considerations. Thank you.
Thank you. Do we have any other registered public speakers?
We do not.
Do we have any members of the public who did not register who would like to provide public comment? Anyone? Seeing none, that concludes our public hearing and the special finance committee meeting. I'm going to declare the meeting adjourned and note that the finance committee will review and consider the preliminary budget at its next regular meeting on Thursday, August 20th at 10 a.m. Thank you.